Good morning everyone. Today we're going to talk about an antifungal drug classification named polyenes. So polyenes is the first antifungal antibiotic. Polyenes are multiple conjugated double bonds, macrolides, large rings with lactone linkage. As per its mechanism of action, the macrolide ring inserts into the membrane binding two sterols, after which cylindrical channels will be formed. Cations then macromolecules leak out of the cell, after which eventually the cell will die. So that's how the polyene kills the fungi. As you can see in the diagram, the polyene attaches itself to the membrane of the fungi cell. After attaching itself to the membrane, channels will be formed, making a hole which will then eventually leak the contents of the cell of the fungi. There are three major polyene agents: 1. Nystatin, 2. Amphotericin B, and 3. Pimarisine. For its clinical use, it is used to treat candida infection of the skin, including diaper rash, thrush, esophageal candidiasis, and vaginal yeast infection. It may also be used to prevent candidiasis in those who are at high risk. For its pharmacokinetic, polyenes are not significantly absorbed in the gastrointestinal tract and are excreted mainly in the urine in its unchanged form. For its adverse effect, one of the most notable is fever, chills, nausea, headache, and occasional hypotension. These are all caused by an infusion-related reaction under amphotericin B medication for adults and older children. Furthermore, renal insufficiency with occasional renal failure, hypokalemia, and hypomagnesemia caused by excessive renal losses, bone marrow suppression, with anemia and thrombocytopenia, abnormalities in hepatic enzymes, and renal failure at worst for neonates. On medication precautions, it should be used with care in patients with reduced renal function. Frequent monitoring of renal function is recommended. In some patients, hydration and sodium repletion prior to amphotericin administration may reduce the risk of developing nephrotoxicity. Lastly, for its contraindication, it is contraindicated to patients with known hypersensitivity to amphotericin and nystatin.